We feed breathing gas in, either oxygen or air, and it forces it in to increase the pressure.
This is how 2-year-old Montrealer Alyssia Tétrault spends parts of his days, undergoing hyperbaric oxygen therapy in the U.S. His parents, Nicolas and Melissa, uprooted their lives and had him transferred from the Montreal Children's Hospital to New Orleans, alleging doctors wrote off his chances of survival following his near drowning in October 2024. Arthur was medevaced to Louisiana on November 29th, where his father says the prognosis was incomparable to that of the Montreal Children's.
7 weeks in Montreal, and after 5 weeks, they said they were going to unplug him. We've been 7 weeks in the hospital here, and we're going home Monday. And he's breathing on his own and doing really better. Look at him. He's doing 1,000,000 times better. So I feel that there's a huge discrepancy in between our healthcare system in Canada and the one in the U.S.
Dr. Paul G. Harch, owner and director of Harch Hyperbaric, says he's treated close to 160 cases of post-drowning in children since 1989, and now Arthur is under his care.
Severely injured, but lesser injured than many of the children that I see. So he had upper airway obstruction and needed a tracheostomy, and apparently the decision was not to perform that at Montreal Children's because a palliative care consult had been done.
Just over a month into his care in Louisiana, he got the green light for this treatment.
In Montreal, you could not get treated at all if you have a brain damage with hyperbaric oxygen therapy. It's still not a recognized treatment here. And even if we have a lot of data and a lot of proof that this treatment can help.
2 hospitals in the province have hyperbaric chambers, the Sacré-Cœur in Montreal and one in Quebec City. Health Canada outlines only 14 conditions when these machines could be used, including carbon monoxide poisoning, frostbite, embolisms, but not post-drownings. The Montreal Children's told City News that hyperbaric oxygen is not recommended by international standards of care for the chronic treatment of oxygen deprivation brain injury after resuscitated cardiac arrest.
There are many studies with all kinds of brain damage that show that you can have a lot of improvement. And I've seen, a few patients that have been drowned, and we treated them after that, and, they could recuperate a lot.
We could have all done this in Montreal. Everything is there. The best doctors, the best technology, the best machine.
Tétrault says he'll now be in the U.S. for at least another 6 months.
I think we're going to bring him back to you in an interview in 6 months, walking and talking.
In Montreal, Alyssia Rubertucci, City News.